All of you have been hearing from me since morning. I'm Suesha Sawan, Deputy Editor, India Today. I shall be moderating this session. Can we please have all the speakers on stage? All right, thank you so much. And I think I'd like to begin with the most basic question, Dr. Trehan. Guilty as I plead, but for a lot of us now, ChatGPT is becoming the first go-to doctor. And any initial symptoms, the first thing we do is click on ChatGPT, put it all out, ask whether we should go to a doctor or what medicines we should take. Really wanting to hear from you on this, the word that you put out for everyone listening here.
So there are multiple aspects to this. One, of course, it translates into socho mat. You have some feedback. Okay. The danger of that, the other aspect is that you get so involved in the possibilities of what you may have that the anxiety levels go up so high, and then till you have found the right help for it. The third is that it is a good tool to have at your disposal to say, yes, you need to go to a doctor or you need something, okay? So if you actually just did not have any feedback, you may just console yourself, let me see how if it go away or what happens. And especially in our field with cardiac, you know, so many people lose their lives just thinking it must be acidity, it may be, oh, it can't be happening to me, I've got too many responsibilities. So there are many, many things that make you lose that urgency. And I think a tool like ChatGPT, which was Google was already there, is a ready reference for your symptoms, and you have a friend in that. So I think it's a very positive thing to happen, but at the same time, it can trigger anxiety reactions which are unfounded till you find the right help.
And it is an AI tool at the end of the day. It hugely depends on the prompts that you're giving it. Possibility of it also guiding you in the wrong manner.
Well,
okay, please go ahead.
Yes.
No, I think this is something that we all know, right? Is that the AI tool is based on the data that it gives and the data that you have fed it. So, for instance, I've got a long ChatGPT thread just for my mother. I have input all of the information of her blood tests, what happens with her appointments, what's going on, and I've also built out the personality of my chat specifically to look at case studies, to look at studies of the best cardiologists in the world, to think about diabetes, to think about high blood pressure. So the more data that you give it, and we're seeing that with a number of AI tools, the more it can inform not just your own opinion, which we see that reinforces in a number of tools, but it can actually give you at least real-time options, which otherwise you can't always contact a doctor in the middle of the night. And so far, at least it's been a component of the thinking. I don't think it should be everything at this stage, but for me, it's been a component that I can keep building out and feeding information to so it can be more thorough and more effective than it would be just as a random AI tool.
And you know, Vivek, for sometimes for doctors, it can get mechanical to answer too many questions. And there are also those who I know who go on to say that when I put the same technical terms that the doctor has spelled out for me on ChatGPT, it helps me understand much better what the problem is because I can ask it 10 questions and it breaks it down really easy.
Absolutely. Yeah, definitely that is a great tool to have. And when you mentioned that specific to a doctor, what happens, these tools will actually save a lot of time for the doctors and for hospitals itself. We strongly believe that there is a lot of inefficiency sitting in healthcare systems today. About 60% of inefficiency sitting in healthcare systems today. India has one of the lower doctor to population ratio and beds to population ratio when you compare it with the rest of the world. Which means you'd expect Indian hospitals to be brimming with occupancy, given that there is a supply-demand gap. But surprisingly, when you walk into private hospitals, you see that occupancy is not that high. Private hospitals in India is somewhere at 60% occupancy, which is a manifestation of the affordability gap, of the accessibility gap, of trust that is there. Given that occupancy of private hospitals is on the lower side, you would expect that throughput is extremely high. But you know what we see in every hospital? You see people sitting and waiting in different areas of the hospital, which is a manifestation of the underlying inefficiency in the healthcare system. And that is where we see ChatGPT or LLMs or AI as a broader category playing a huge role in eliminating that inefficiency, which is basically data movement, data summarization, answering things from data, and providing suggestions to people in a timely manner to be able to eliminate all of that.
All right, my colleague Sonal also joining us.
Well, somebody was missing from the panel. Well, it's not me, it's AI, isn't it? Right?
Not missing at all. We've been having a lot of conversations.
So I thought it would be a good idea to ask AI a question, on health. So on my way here, and by the way, one thing that AI should, solve for is traffic. To all those people sitting here, please solve for traffic before anything else. But on my way, I asked ChatGPT this question, which I'm sure all of you want to know as well. I typed in and I said, hey GPT, Elon Musk says that AI will replace doctors. What do you think? I let the chatbot give me an answer and then I'll come to the humans, okay? You want to know what ChatGPT said, yeah? Okay. It said, AI will dramatically change medicine, but full replacement of doctors is highly unlikely in the near future. It already performs very well in narrow tasks like reading scans and analyzing large data sets. However, medicine is not just diagnosis. It involves judgment, ethics, empathy, and accountability. Patients trust humans with life-altering decisions, and that cannot be automated easily. More realistically, doctors who use AI will replace doctors who do not. I have to say, we have to give a round of applause to GPT. That's a very good answer.
No, not only applause, it's very reassuring to us.
But the last line, Dr. Trehan, it says doctors who use AI will replace doctors who do not.
That's correct. That is absolutely correct. If you look at history of how evolution has taken place in medicine, technology, and the use of AI. AI is not new to medicine, by the way, because we've been using algorithms, machine learning for many, many years. Robots were created in the late 1970 something. We brought the first robot to India in 2002. So, all this stuff has progressively gone in a direction where it's true that if you do not use, errors are known, medical errors are known. It is known that 100,000 plus lives are lost in the United States, which is supposed to be a well-oiled healthcare system. Okay. I shudder to even think if human errors, how many people would have lost their lives in India. Okay. So, what you're saying is, over-dependence on AI has the same danger as over-dependence on yourself. See, somebody said very rightly, the illiterates of the world are not going to be people who have gone to college and are professors. The illiterates of the world are going to be those people who cannot unlearn and learn again. So it says it all. As far as, this is the new wave. If you didn't learn internet, if you didn't learn, it's so convenient to use a cell phone. So that was the second revolution.
That's very nicely put, but there are also several gaps, Dr. Trehan, and I want Vivek to get in on this one. The biggest problem with India at the moment is not that we lack AI innovation, it is that we lack unaffordability, right? We are trying to bridge that gap. With what you are doing at Narayana Hospital, have you managed to use AI to cut down cost? Because that's the key question here.
Absolutely. So fantastic question, first of all. And that is one of the main reasons why AI remains in pilot stages in many institutions. It is because you're not thinking of return on investment when you're investing into an AI project. Because finally, at the end of the day, who pays for this AI? That is the question. And the person who pays for this AI, where ROI is not clear, in which case it is a gamble. So the person who pays for this AI gamble is the patient. Yeah. Can the patient afford to pay for that gamble? That's the question. Which means if you're trying out fancy AI projects one after another, where your end objective and your path to the objective is not clear, they're most likely going to fail because you're going to have to increase your costs to the patient. So it is extremely pertinent that the institution that is implementing AI have a clear objective on what this is going to solve, and not that it is a fancy toy that I get to play with. Yeah. Once your objective and purpose is clear, and your route to ROI is clear, which is basically the financial benefit that it is going to deliver, then you will be able to deliver it at the right cost for the patient.
Yeah. But Anjali,
also wanting to understand from the point of view of surgeries, because there has been a lot of talk that when it comes to surgeries in the future, would largely now be taken over by robotics, machine.
That's the tricky part, no, Suesha. India is not one India. India is 1, 2, and 3. In India, in people like us, in societies like these, we talk about robotic surgery, we talk about affordability. In other parts of India, the point is of access, which is what I wanted to come to Anjali for.
How is that shift going to be?
Yeah, how will you manage that? A lot of AI innovation seems to be working for affluent India, but what about access where it's really required?
I think that works for AI across the global south, and this is what the AI summit is about, right? So for the first time, you have a global summit focused on impact, led by the global south, and specifically looking at access and looking at equity. The previous panels have talked about this, but I think it's important to remember that low bandwidth environments is what we should be designing AI for. And that needs to be intentional design in thinking about vernacular languages, voice operated apps. How do you think about low cost in the apps actually landing in these places? And all of that can only happen in the beginnings of the stages, right? So what you're seeing in India and a number of other countries is that you've got silos in products and innovations that are happening, and they haven't, from their initial stages in terms of healthcare, aligned with the government's national architecture of health. And if you don't do that intentionally from the beginning, what you end up doing is then just bolting on afterwards to the health system instead of building an interoperability within that health system. That's what addresses your low resource environment, but it also addresses where AI needs to hit, which is the community level. The community level is not at your tertiary hospital, it's at the community health clinics, and they need an expansion of access to healthcare and to human resources, which AI should do.
Yeah, but AI is also all about accuracy, right? And Dr. Geetha, come in on this point. Accuracy is only as good as the data. How far are we on the India data set? And I want to take that question to Dr. Trehan later as well. Is he comfortable even applying, or even Vivek for that matter, applying those same AI tools which are not built on Indian genome body types? It's not built for us. It's largely resting in the West.
Yeah, so before I answer the training set required for the accuracy, I would like to make a small comment about the previous question as well, if you allow me. So essentially, how do we enable AI-enabled tools to make the underserved population get to the higher infrastructure at the right time And that's, I think, is the profound use case that can help Indian economy. Because I really believe there is a healthcare divide in India. Just like we used to talk about IT divide, there is a healthcare, really, there is a healthcare divide from access and so on. And AI can be a super tool for this. And for example, at NIRAMAI, we've actually made this possible with AI-based triaging for breast cancer screening, right? So where women who were earlier detecting cancer by hand are now able to come into the hospital for more detailed diagnostics just with AI kind of automated, I would say, for a red, yellow, green by just taking a few pictures. So it's really possible to do this. Now, coming to the data problem, I sort of flip it the other way and say, as a founder or developer of the AI models, right, we have to foresee this, right? Where is it going to be used? Have I trained the model sufficiently enough so that the intended use cases, intended areas, targeted users are able to use this accurately? And I think Vivek ji mentioned nicely that if there is an error in AI, who is paying for it? The end user. Yes. So if I wear the founder hat or AI developer hat, we have to look at the user and develop it for her, right? So that our accuracy will be much better for the targeted user. And what that means is we have to train our models with diverse data sets, whether it is there in the current AI data stack or not, in the hospitals or not. It's our duty to actually ensure we get to the data. Yeah. Again, in our case, we really had to look at all of these 5 million data points that we had and collect the data. It took me 2 years to collect 256 patients' data of thermal images, mammography, ultrasound, biopsy, and later, of course, it became much before. So,
ma'am, but you're talking about usage. The question is also about responsibility.
Exactly.
If the algo gets it wrong, who's responsible? Is
And
it
I think
the
most
doctor?
importantly in the question of mental health, because these days a lot of people are depending on ChatGPT to also be their shrink. And 2 points really here. There have been cases where ChatGPT has led them in the wrong direction, and there have been unfortunately cases of suicide. Secondly, again, the biggest point that we've been discussing since morning of how much of you is getting mapped by AI when you're literally sharing everything about your mental health with it.
I think we should not depend on ChatGPT for diagnosis for sure, like Trehan sir mentioned.
Dr. Trehan will have other stories to
Yeah,
tell
but
about
I think
patients
we need to
who
make
enter
sure,
his clinic.
Yeah, we need to make sure the AI is sufficiently clinically validated and regulatory clear to be a medical device. Otherwise, taking advice from it is really not worth it.
But Swesha, we've been speaking so much about AI and data sets and all of it. I want to talk about AI of the everyday and AI of the now right now. Dr. Trehan, I'm guilty of being one of them, but I have to ask you, are you also bombarded with patients who come to your clinic now with detailed diagnosis from GPT and Gemini?
We started this conversation with exactly that question.
But I want to know if they have an opposite diagnosis from what you're saying. How do you respond?
No, see, it is a very good thing to happen. People used to depend on Google. Now it's ChatGPT. And you always like to know a well-informed patient or their family. It's not because most patients are a little older, they don't use that much, but they come with their kids who have actually mastered the art. So it's actually, in a way, some people think it's a challenge or a headache. It's not. It is something that stimulates you to be able to mull through all the diagnoses yourself and also explain to them in detail so if a family is caring and intelligent about what they are heading for, it's much better from our point of view.
And when it comes to mental health?
Mental health, this is a very tricky subject. Like Geetha said, you don't outsource your mental health to ChatGPT. If you have anxiety, then maybe it's a good tool to talk to. People you can have a full conversation. But I don't think you should go as far as treating it like your therapist. Yeah. It's not equipped to do it because of the fact when somebody pointed out that look, all the data points which are today current, only X-rays, mammograms, are done in India, the data that has laid on a layer of accuracy on, like if you look at chest x-rays, which are the most basic x-rays done, the AI tools have actually detected nodules which are way, way beyond the human eye. Okay? So that is, I think, a great contribution to a point. Now, what are the dangers of that? Say, like, if you have a nodule, then you say, okay, what do? I must go to a doctor. Then the doctor says, I'll do a biopsy. And then they've taken you to a different loop completely, where it turns out to be nothing. So you have to lay the experience on it. That's why one of the things is that doctor's experience will tell you that if you detect something, the first thing to do is revisit it 6 months and a year later. If it is changing in size or character, of course you must act. If it is not, if it is a 1 or 2 millimeter nodule that was detected, you should watch it rather than go and do an operation for it.
Yeah.
Okay, those are so responsibilities of how you're going to use AI for doctors. That's why we talked about the doctor who is not AI enabled
Yeah.
will be always at a disadvantage. You will not ever reach the point of precision. With AI is a real good tool to achieve.
We have last few minutes, so I have to ask you this, and we'll quickly go around the panel as well. Do you know that in China at the moment there are vending machines where they put a doctor inside, and that doctor is supposed to answer all those questions and give you the drugs instantly? That is one extreme. But on the other side, what is the one thing, and let's begin with Dr. Geetha there, what is the one thing you really hope AI will solve for in this lifetime? I'm not talking about future possibilities. If AI were to solve for one thing medically in India at the moment, what would it be?
It's bridging the healthcare divide, right? I really feel that preventative care, it's an amazing tool to have, and not just automated. It should be in the hands of a health worker at least, because it's really pathetic when you go to the rural areas and they don't have a doctor to go to, and get the healthcare worker a little bit trained on how to use the tool. And really, if you can get the affordable, high quality healthcare to everyone, I think that's something we should definitely
Vivek,
aim for.
Everybody talks about AI with jobs. Doctors don't have to be worried. We are anyways we need more doctors. Is there a way in which AI can solve for that gap?
Absolutely, absolutely. It will make doctors extremely more productive. Not just doctors, but the healthcare infrastructure that we have as a country. Even after all of these years, we spend very little on healthcare as a percentage of GDP, and there is a lot of ground for us to cover. AI will help us cover that ground extremely quickly. And finally, about AI replacing doctors, that is not going to happen in the near future, because as it was pointed out in the panel earlier, we all want accountability to be there with a human, and not with a computer program that is not visible to us and we don't know who has developed it.
In fact, I quickly want to share a recent example of how hospitals are now slowly going to have AI receive the first call instead of a receptionist, hear out your symptoms, and then suggest a doctor, fix up that appointment, and then the patient will come according to what AI suggests is the doctor. So if it's a skin problem, then it's a dermat. Again, hospitals are headed that way. How safe, not safe, we're really treading that path.
Anjali, you want to take that?
So, just to speak more broadly, for AI in healthcare and for many other sectors, it's not a technology story. That's not what I think. It's a governance story, it's an institution story, and it's a trust story. So that's what we need to be focusing on in India and the broader global south. And once you understand how to strengthen those aspects, the technology can actually be a part of the system. We have to be thinking about systems itself and not just one solution by one solution.
Yeah. Dr. Trehan, what would you like AI to solve for? Would you like it to predict
So-
the next pandemic
so-
or solve for air pollution?
So there are two things. One, these are early days. And one is localization to India. So when there are models existing which actually are predictive models for areas which are not mapped in India, I think that you'll always have a flaw in it. So what you can actually use today is to mine data very rapidly and lead to drug discovery, new modalities of treating different diseases, and the fact that India will play a major role in the world in drug discovery because we are lucky to have a very diverse gene pool. Not many countries have that because we had the Alexander's armies from the west, Genghis Khan and his gang from the east, and then the Mughals came from the north. So that whole gene pool mixing, and they were very generous with their sperm. So there is a huge diversity in our own population. So that's why I'm saying that there has to be a great opportunity for India to harness AI to actually help the world also, because not, like I said, there are pure gene pools in most parts of the world. So that's one advantage. The other thing is that India needs to get into innovation drugs. We are paying a very heavy price because all the innovation is being done overseas. We are very happy being a pharmacy to the world, but copycat pharmacy. So it will help us to catapult us into, like we leapfrogged telephony. India is still the most sophisticated telephone system right now, the wireless telephone. I think we can be the same at a very high level for the pharmacy of the world, not copycat.
Very nicely
Wonderful.
said.
Yes.
I'm afraid that's all the time we have. But I think safe to say that when AI is all about probability, remember health is all about responsibility. And we need doctors for that, don't we? More than just
And the
AI.
other conclusion, through all the sessions that have happened, news anchors may not be losing their jobs. Doctors are certainly not losing their jobs.
Not yet, at least. Thank you so much, all of you, for being here today. And thank you for the
Thank you
audience
so
as
much.
well.
Thank you.